Health and safety is another module of Interact, and it is integrated with things like risk management and reporting, of course, and workflow and many other things. So if we look at what the health and safety setup is like, you will find that our system is designed as a global HRMS. So while there are standards in different countries, we can adjust to them, or we can allow you to create your own manner in which you want to work with health and safety. So for example, here's a list of injuries and some illnesses, but obviously there is no limit, and you can add your own injuries and illnesses as you like. Here I have set it up that I want to follow the OSHA classification, and otherwise, if I'm not using OSHA, I can describe the type of reporting that I want to use instead. Now, the logic is very simple. Through self-service, through mobile devices, and so on, your employees will log health and safety incidents. Here's one example that was logged already. It shows the details. There was a poisoning incident that meant there was some inhaling of poisonous gas, and the person was away from work for a number of days, and in fact they had to be treated. It'll allow you to track where was the individual treated, which was his emergency or regular clinic, and the details about the actual incident. You will be able to describe any amount of detail that you want here. So the whole idea is that the safety officers can enter this type of information online, and then you will have your reporting available for this. So you have an injury and illness case form. Again, this is specific to the US, but we can provide this for other countries too. This would be a form that can be filled, or that will be auto-populated with the earlier information that we just collected. Secondly, there is the Form 300. This shows you all the incidents that occurred. So obviously we are cutting back on the amount of reporting that you have to do, because the system will automatically log all these cases that are reported. Once you report them in the system, there's no need to transfer that anymore to any other reports. So that's the whole point of having a system. The other report we have here is the 300A. So here's a report that has been filled. The system has automatically updated all the records that are relevant. So the system will automatically fill in your form as it is required based on the information that we have in the system. That's the whole point of having such a solution. No need to do any manual data entry anymore. Everything will be done for you. Here's the log that results from the information that's been submitted. You see that there's no need to manually enter anything. The system is taking care of this for you and will report it for you also. So the objective is therefore to minimize the paperwork, to make sure everything is properly documented, to be able to refer to it when you need to, and to get alerts out there to the right people, of course, if there's a need. Again, the way it starts is for you to just go in here and say, I want to log a new health and safety incident, and you create a new one on the spot, and you just fill in the details for the specific employee that you're reporting this for. And then you fill in your information for treatment and details of the actual incident. And that's all it takes to do OSHA reporting and Interact HRMS. But we can link it to training, we can link it to policy publishing, we can link it to risk management. So there are many ways to extend the use of the system, but the core is designed like this. And again, in other countries where reporting is different or the classifications are different, that's all fine. All of that is going to be based on your setup that you create, and we can provide you with unique reporting formats depending on what it is that you need in your particular country. You see the codes, the descriptions, the classification, it's all user defined.